Hi, my name is Sara Bromlow.
My name is Jake Trump.
My name is Joseph Fortebuono. We are group number 1043, and we had project number 3. For our project, we were required to redesign a spica cast. Spica casts are used in infants with developmental hip dysplasia and in young children who had femur fracture surgeries. A hip spica cast usually takes 1 to 2 hours to apply and is done under anesthesia in the operating room. The length of time the cast needs to be on varies from about 6 weeks to 3 months. Depending on the condition being treated, the actual position of the body and the legs in the cast will also vary slightly depending on the reasons for the casting. The recovery process is very demanding for both the parents and the child. Our goal is to make the spica cast less challenging for patients and parents, making the cast more comfortable, lighter, sanitary, and cooler through the use of new materials will help many patients who have to use the spica cast.
One of the features of the cast will be a new exterior material. We replaced the typical plaster on the outside with a much lighter material called fiberglass. Fiberglass serves the same purpose as plaster, but is much lighter and just as durable. Fiberglass is a much lighter alternative because it is fiber reinforced with polymer made of a plastic matrix that is then reinforced by the fine fibers of glass.
The typical material used as the padding for the cast commonly leads to skin irritability and infection. This is one of the main problems of spica casts. Keeping the cast clean and dry is challenging for all caregivers. To help prevent skin breakdown, the new spica cast will be lined with a material called Coolmax. Coolmax is a wicking material that pulls moisture away from the skin through tubes in the fabric. Ultimately, this material will help keep the skin clean and dry as well as prevent irritation.
I will now show you a video demonstrating the Coolmax technology, followed by our sketch of the spica. Okay, now we have Sara is going to do the design of our new spica cast. As we explained in our audio, this is a new design that uses both fiberglass and Coolmax to ensure the young child has a much more pleasurable experience than it did before. She's currently drawing the head and the arms. She's now going to produce a close-up of what the actual spica look like. It's a little bit hard. On the right-hand side, you got the fiberglass design. The inside, you got the cotton balls for comfort. And on the left, you get the Coolmax technology fiber, which will keep the baby nice and dry while it's wearing the spica. And there you have it. There's our design.
In conclusion, the currently used spica casts, made of plaster and cotton, are heavy and uncomfortable. Switching to fiberglass and Coolmax will make the cast lighter and prevent skin irritability overall. The new design will help the patient to get through the recovery process with less challenges.